In our last video, we had just begun to discuss some of the differences between American physicians and Spanish physicians. And we started to find out some of the reasons why Spanish physicians or doctors at the time would have been considered geniuses as opposed to their American counterparts. Part of this is largely in part for the fact of the matter that as opposed to the average practicing doctor in America, whether he went to medical school or received his certificate from tutelage of an experienced doctor, there were still a few other criteria that had to be met that were not met in America. In Spain, however, things were a lot more, shall we say, strict, and especially in deciding who was and who wasn't qualified to be a doctor. Now, interestingly enough, prior to this point in American history, or in Spanish history as well, we see that the Moors or Muslims, they had controlled Spain for about 700 years, and in that time they had begun to make great advancements in the fields of medical science and knowledge, which was then passed on down to the Spanish. This was largely due in part to the fact that they had saved some of the teachings from the Romans, the Greeks, and Egyptians. But also, when it came to becoming a doctor in Spain, you see that not only did they have to undergo 8 years of university, but they also followed it up by 2 years of residency. And then every 5 years, they had to undergo a competency hearing to ensure that they had maintained all the knowledge that was taught to them and that they were up to date on the latest burgeoning medical theories or medical practices. Now, this is vastly different in America, and I'm sure it happened in Spanish territories as well, but this is vastly different because we see that in America, the odd quack doctor could just wake up one day, decide to be a doctor, and hang out a shingle before practicing. And this practice, interestingly enough, was not outlawed until 1910. And so we see how over the year this will gradually evolve into that tried and true, trusted snake oil salesman that we think of from the Wild Wild West. But when it came to the Spanish physicians, they, of course, as previously stated, had learned from the Moors or Muslims. And this was very important to note because the Muslims were very religious, and part of their religion stated that it was unholy to be dirty. So they were very, very strict about keeping themselves clean, keeping their clothes clean, and of course eating utensils as well as surgical implements, keeping those clean as well. And they would not only wash their hands, but also their surgical tools before, during, and after any kind of procedure. Whereas in America, that was almost unheard of for a few reasons. One is that pre-germ theory, most people thought that diseases were spread through toxic vapors, which were called miasmas. Now, the Spanish believed in this too, but this is where things kind of start to shape up between the differences. Because some of the Protestant teachings in America at that time said that, well, essentially God made dirt don't hurt. Well, they believed that dirt could actually be a protective layer on the body to prevent evil spirits from trying to get in and possess you. So many people avoided washing their hands for that reason or several others. And bearing this in mind with dirty tools, dirty hands, an American physician would have no problem possibly going from working on a cadaver to treating a patient, or going straight from a cadaver to helping to deliver a baby, whose mother was in childbirth. And this, of course, led to a lot of the buildup of bacteria and germs, which, of course, we know about today. But unfortunately, that means that those germs are going to spread and lead to infections and diseases, causing a high mortality rate. Now, we're going to discuss a few more of the differences between the two as we progress, and we hope you'll follow along with us as we study medicine and medical practices of the 18th and 19th century.